by Ms. Cirillo, moves that Bill C-216, an act to amend the Controlled Drugs and Substances Act and to enact the Expungement of Certain Drug-Related Convictions Act and the National Strategy on Substance Use Act be now read a second time and referred to the Standing Committee on Health. Debate. The Honourable Member for Courtenay-Alberni.
Thank you, Madam Speaker. It's just a huge honour to draw third order and precedence in this Parliament, Madam Speaker, to be able to table such an important piece of legislation. So it's my privilege tonight to introduce, it is emotional for me, Madam Speaker, because this is such an important bill. Bill C-216, a health-based approach to Substance Use Act today. And I want to thank my Deputy House Critic for the NDP from Port Moody, Coquitlam, for seconding this bill. Now, this bill's not new. It was originally tabled by the member from Vancouver Kingsway in the 43rd Parliament, but it died on the order paper because of an unnecessary election. Now, its time has come, and we can't delay anymore, Madam Speaker, which is why we're using this as the third bill in this House to debate, because lives are at stake, Madam Speaker. We know this from the same public health experts who asked us to follow the science at the beginning of the pandemic. We know this from provincial coroners' reports who tell the story with statistical evidence of record-breaking numbers of overdose deaths in our cities, our towns, and our rural communities. We know the time has come to debate these measures from Canada's police chiefs and from the municipal governments of our largest cities, supporting the decriminalization of possession of illicit drugs for personal use and providing access to a safe, regulated supply of drugs for users. We know the time has come from the families and loved ones of so many victims of drug poisoning, and from the heartbreaking stories the media reports about their pain. And each of us in this House, everyone, knows all too well the time has come for common sense reforms of Canada's drug laws from the phone calls we receive from our constituents, from mums and dads, brothers and sisters, friends and neighbours about overdose deaths caused by drug poisoning. They all tell us, they are telling us, the time has come to act on the decriminalization of simple possession and for the provision of a safe, regulated supply of substances. They're all asking us, Madam Speaker, to save lives. As the former provincial medical health officer of health from my home province in British Columbia, Dr. Perry Kendall said recently, quote, "The latest figures are unconscionable, and it's past time for an adult conversation, an adult discussion about drug policy. This bill is a health-based approach to substance use, and the debate is about having that adult discussion that hasn't taken place, Madam Speaker, in the history of this House. We know from the evidence that the so-called war on drugs has not worked over the past many decades. As frontline workers fighting to save lives on the streets of our towns and our cities remind us, it hasn't been so much a war on drugs, but it's been, and it continues to be, a war on drug users. The fact is that because a son or a daughter, a friend or a neighbor is addicted to drugs or just a weekend user, it shouldn't be a death sentence. Because too often it is. Sentenced to death by drugs poisoned with fentanyl and other dangerous substances by organized crime, seeking to maximize profits. In fact, fentanyl, Madam Speaker, is 100 times more potent than morphine, 50 times more potent than heroin, and is orders of magnitude cheaper to traffic than other drugs, creating a huge economic incentive at the cost of lives. A few grains of fentanyl can cause overdose and death. I know there is support in this Parliament for the measures proposed in this bill from many members and from many parties, and I am grateful for that support, especially my own party, Madam Speaker. They've been behind this the whole way. We may not all agree on the same specific actions required, but we all want to stop the harm. In 2020, Health Canada asked 18 esteemed experts in the field of substance use, and Addictions to come together as an expert task force on substance use and consider alternatives to criminal penalties for the simple possession of illicit drugs. The government promised it would be informed by this task force in its policy making going forward. It became a campaign promise, in fact. The expert task force was mindful of 5 core issues: stigma, disproportionate harms to populations experiencing structural inequity, harms from the illicit drug market, the financial burden on the health and criminal justice systems, and unaddressed underlying conditions. In May of 2021, we heard from these experts and were informed by their near unanimous recommendations. Not surprisingly, their recommendations mirror the measures proposed in this bill today for a truly health-based approach to substance use. In the same way that we listened to the advice of public health professionals in dealing with COVID-19 and the pandemic, we must listen to these experts about the overdose crisis, which is killing increasing numbers of Canadians from coast to coast to coast. First, the task force found that the criminalization of simple possession causes harms to Canadians, and it needs to end. These aren't my words, Madam Speaker. They come from this body of esteemed experts gathered together by this government to guide the actions intended to save lives. Now, I'm going to repeat that again, Madam Speaker. Quote, first, the task force found that criminalization of simple possession causes harms to Canadians and needs to end. This is a human rights issue, Madam Speaker. Now, it's been more than 10 months and hundreds of deaths since the City of Vancouver applied for Section 56 decriminalization exemption with the support of its medical health officer and its chief of police. This is the exact same process Vancouver used to get the first supervised consumption site almost 20 years ago. The federal government of the day backed the city against provincial opposition as the need was so dire. This took courage and political will. The need is more dire today, Madam Speaker. We all know this. But for whatever reason, the Vancouver application, now joined by applications by British Columbia and the City of Toronto, sit on the minister's desk. Secondly, the government was informed by its own expert task force that, I quote, as part of decriminalization, criminal records from previous offences related to simple possession be fully expunged. This should be complete deletion, automatic, and cost-free. It's right in their report. This bill calls for full expungement of records of conviction for simple possession. It's time to relieve Canadians of this unnecessary burden. Why? Because those Canadians who are burdened with records of criminal conviction for simple possession of illicit substances face often insurmountable barriers, to employment, housing, child custody, and travel. Thirdly, this bill calls for a national plan, a strategy, Madam Speaker, to expand access to harm reduction, treatment, and recovery services across Canada. Importantly, this must include ensuring access to a regulated, safe supply for users. Instead of leaving the drug supply to gangs driven to maximize profits at the expense of lives, we must support the domestic production and regulation of a safer supply that is readily available and accessible to users. It has been more than almost 2 decades since the first sanctioned supervised consumption site opened, and another decade since the Supreme Court unanimously ruled that it must remain open. Yet there are still only a few dozen in the entire country. Why so few? Why such limited access for those who need the service? I submit it's because of a continued stigma and criminalization of drug users. Unfortunately, as these common sense reforms are advanced on a daily basis by public health professionals, law enforcement, the media, frontline workers, and substance users and their families, they've been given very little attention by this government. It's been 6 years, Madam Speaker. The overdose crisis isn't even mentioned in the Prime Minister's mandate letter to the Minister of Health and given a low priority in his letter to the Minister of Mental Health and Addictions. Wasn't even in the speech from the throne. This crisis must be treated with urgency. It's a health emergency, Madam Speaker. Slow walking essential reforms through protracted political and bureaucratic deliberation, or worse, ignoring them altogether, will only result in more preventable deaths. We all want lives to be safe, so let's take the politics out of the overdose and toxic drug supply crisis. Madam Speaker, Indigenous people are disproportionately affected, and we must work with them in partnership on the implementation of a health-based approach. Frontline workers struggling day in and day out to save lives, they must also be partners in implementing a health-based approach. Public health professionals and law enforcement must be engaged along with territorial, provincial, and municipal governments. In summary, I ask for your consideration of the three essential measures proposed in this bill. First, the stigma of substance use can be addressed by repealing the provision of the Controlled Drugs and Substances Act that makes it an offence to personally possess certain substances. Second, barriers to employment, housing, and other essential of life be removed for Canadians with certain drug-related convictions through the destruction or removal of the judicial records of those convictions that are in federal systems. And third, Madam Speaker, and finally, a health-based approach to substance use can be created through a national strategy on Substance Use Act, which would require the Minister of Health to address the harm caused by problematic substance use. A national strategy should include, but not be limited by, access to a safe, regulated supply of substances for users, universal access to recovery, trauma-based treatment and harm reduction services, prevention programs and outreach, and public awareness programs. None of the above should cause this government to delay further the approval of applications by British Columbia and the cities of Vancouver and Toronto for Section 56 decriminalization exemptions. Unfortunately, ministers and their officials continue to hem and haw about the differences between the applications as they pertain to the threshold of quantities that are possessed. This should not be an excuse for delaying our movement as a nation towards decriminalization. Similarly, with the expansion of safe injection sites and the provision of safe drugs under existing laws, we can't let this debate and the legislative and regulatory actions that must follow delay or defer providing access to a safe supply now. Evidence shows that users are not dying from overdoses in safe injection sites where they exist. In fact, there has not been a single overdose death in any of the safe injection sites in this country, Madam Speaker. Not one, not a single overdose death. We learned from this that a regulated, safer supply will save lives. And as I said at the beginning of my remarks, this bill, a health-based approach to substance use, aims to save lives. The Public Health Agency of Canada projects that we will lose at least another 3,000 Canadians just in the first half of this year alone. This is not just a statistic, Madam Speaker, this is a tragedy. This is an enormous loss of life. And of course, in the stories of the families who have just lost loved ones to illicit drug poisoning, when we know from the evidence and from the advice of public experts that these deaths could have been prevented. Now, who are they? 75% of the deaths are men. The majority between people aged 20 to 49 years old. The Indigenous people are especially at high risk in our country, Madam Speaker. In BC, my own province, First Nations people died of an overdose rate of 5.3 times the rate of other residents in 2020. Most are economically vulnerable. Only a quarter of the men and a third of the women had some level of employment. And for those who were employed, most were concentrated in the trades and other physically demanding occupations that were also more prone to higher rates of injury and unmanaged pain. They are dying alone. In Ontario, 75% of fatal overdoses in 2021 occurred where no one was present to intervene. In BC, 83% of overdose deaths occurred inside, more than half in private residence. We know from the Public Health Agency of Canada that without significant interventions, the rate of deaths and harms will worsen, and altering the course of the overdose crisis will become even more challenging. Over the past 6 years, we've lost over 25,000 lives, and Canada still does not have a strategy. We know from coroner's reports, frontline workers and users that people are dying from drugs that are, for the most part, poisoned with fentanyl and other chemicals to maximize profit of organized crime. Some are addicted to illicit drugs. Many are not. They're occasional users seeking relief from the pain or past trauma or the challenges of everyday life. And I know that some members will say the emphasis of our approach should be limited to providing treatment for addiction. While trauma-based treatment leading to recovery from an addiction is an important component of a health-based approach to substance use, we must stop the harm first. As the member for Vancouver East told this House last month, dead people don't need treatment. I want to thank you, Madam Speaker, all my colleagues in this House, for your consideration of this very important bill, and I look forward to your comments, your ideas, and your questions.
Questions and comments. Questions?